Fall's the season to sign up for health coverage, whether by Medicare or through the state's Health Connector. It's also a time to explore possible enrollment changes. You can get help with the enrollment process from the Mayor's Healthline. To tell us about the Healthline and the enrollment process is the Director of Health Access and Wellness Services at the Boston Public Health Commission, Beth Baker. Thank you very much for being with us, Beth.
Thank you. Thanks for having me.
But what is it exactly that you do at the Healthline that most of us might have a hard time doing ourselves?
Sure. So the staff at the Mayor's Healthline, we are all certified navigators. So what that means is that the state trains us. We go through extensive training, several weeks over the course of the year, to help people both apply for coverage, so to go online and complete the application for health insurance, and then also once you apply for coverage, figuring out, well, what is it that you qualify for? So it may be that you qualify for Mass Health, or it may be that you qualify for a plan through the Health Exchange, the Health Connector. So we help people figure out, okay, what is it that you qualify for? And among, say, there are 10 plans that you qualify for, which one makes the most sense for you and your family? So we help people through the decision tree of, well, who do your doctors accept, right? Do you go to a doctor who only accepts a certain health plan and thinking about that, or do you take certain prescriptions? So it's important for you to have coverage that will allow you to continue to take those prescriptions.
Now, it seems to me if somebody wants to get help from the Healthline, I guess it's probably a good idea to prepare a bit beforehand, maybe put together some information about the health needs in the family, or even about your income.
Yeah, so the big things, you got it. Writing down who are your doctors, who are your specialists for you and everyone in your family, what prescriptions do you take, and making sure even the amount of each prescription that you take. And then income information is important because based on your income you may qualify for subsidies or tax credits, and also knowing who your employer is, and social security numbers for everyone who has them, and dates of birth for everyone who's applying in your household.
I'm going to ask you about the Medicare enrollment because I guess that's not going to change all that dramatically, but I guess there are a lot of people out there who might have this. They might think that, well, I've got a pretty good plan, I'm satisfied with it, but I guess that plan could be changed too, right?
Correct. So at the commission we have the navigators at the Healthline. We also have Shine counselors, and they're also certified by the state to provide services around Medicare for residents of Massachusetts. And they're also able to help you look through if you have different plans through Medicare. Sometimes premiums do go up, and it's important every year to just look at what your plan is. Is the premium going up? And maybe that's okay and you're okay with that, but just to be aware of it, and also to find out if any of the benefits in your plan have changed. And a Shine counselor can walk through all of that with you. But it is important because you can't assume that from year to year the plan is going to be exactly the same.
And even if the plan stays the same, the needs could change too.
Correct. Yep, that's exactly right. So maybe you need to start seeing a certain specialist, or maybe now you're going to have a certain prescription that you have to take monthly. And with one plan, it may be very expensive, the copay, but maybe another plan would allow you to access the prescription at a lower cost.
What about overall program changes in Medicare? Anything that people should be prepared for?
Nothing significant. I think the big changes that we're seeing are really going to be through the Health Connector and Mass Health.
But there will be new ID cards coming out, right?
Yes, new ID cards. So for the next year, starting in April, people will be getting new Medicare cards. So this is a big change for Medicare, and the cards won't have folks' social security numbers on them. So people should be on the lookout for the new cards. And again, it'll be over the course of a year that they're mailing them out to Medicare consumers.
This is BNN News, and we're talking with Beth Baker from the Boston Public Health Commission. Beth, there are changes probably going to be affecting the Health Connector in Massachusetts because of the national changes to Obamacare. We don't know what those are going to be necessarily. But I guess one of the things that happens with Obamacare, and even our own version here, is that you get people who might want to talk to you about the trade-offs between should I get coverage, should I maybe forego coverage. I guess, can you help people sort that out?
Yeah, absolutely. So I would say everyone should get coverage for sure. Everyone should get a health plan. And it's very unique to the individual. So a plan that's good for me may not necessarily be the right plan for you. And we can walk people through, again, looking at who are your providers? How often do you go to the doctor? Maybe you don't go that often. Maybe you have a big surgery coming up, and trying to think through your life circumstances and what plan makes the most sense for you. And it's not always that the highest cost plan is the best plan. You may not need all of those benefits. So we're able to really walk people through that. We also have navigators on staff who speak a total of 6 languages, which is great for people who maybe English isn't their first language, and health insurance is really complicated, and if you're trying to hear about it in a language that isn't your first language, that can be hard. And we also have access to a language line, so if someone comes in who doesn't speak one of the languages that's spoken by our navigators, we can access the language line, so we're able to help really everyone.
I know there has been a lot of worry about the possible cutback in federal subsidies for programs bought through the connector. Does everybody have to worry about that, or are there some people who might be still, held safe from that?
Folks who have unsubsidized plans are probably going to feel the increase more in their premiums. Our advice to everyone, though, is to come in, look at your plan, because everyone will probably see a slight increase in the premium for their healthcare plan. So either if you can do it on your own, do it on your own, but definitely come into our office or one of the other navigator organizations, and you'll be able to see what your premium will be if you stay in your plan. So say you're in a Tufts plan right now, you can see what the Tufts plan is going to cost you next year. You can see, have the benefits changed at all? And maybe you decide, gosh, the premium's going up $50 a month, and that doesn't make sense for you, or that you can't afford that. Well, then we can see, well, what are your other options, so you can keep going to the same providers and you can get the care that you need.
Another concern for your office is that even in a state like Massachusetts, there are still some people out there who need coverage, who are eligible, and either they don't know about it, they don't understand it. I guess you've got to reach people like that too, right?
So we do a lot of outreach in communities. We look at all the data to see where is it that people live who are uninsured, and there are definitely pockets of Boston that have higher rates of uninsured than other areas of Boston. So East Boston and Dorchester have some of the highest rates of uninsured. In Boston, actually some of the highest rates of uninsured in the state. So we do a lot of outreach in those communities. And I think there are a lot of misconceptions about coverage and how expensive it can be. And it can be expensive. I don't want to dismiss that. It can be expensive, but there can also be lower cost plans, and they do look at your income. So based on your income, sort of the less you earn, the less you pay, the more you earn, the more you pay. And we really try to find plans that are affordable for people. And I always say to folks, at least apply and see what you qualify for. Apply, we can help you. And you may decide once you see what you qualify for, you don't want to enroll in a plan, and that's your choice. I'm not going to force anyone. I might try to gently push, but I won't force them into it. But at least know, because knowledge is power. And again, we have a lot of people who come in and say, I haven't been insured for 3 or 4 years. I've been really nervous about it, and it's overwhelming, all the choices. And then we walk them through it, and they're like, that's not that bad. Once you sort of break it down, they're like, oh, I'm only paying $60 a month, and that's affordable to me. And it's that peace of mind. Now I can go to the doctor when before, I haven't gone.
Of course, the other consideration here is that even if you're young enough and healthy enough, and you're not worried about your own medical treatment, you might have children who need something, right?
And I think too, a lot of people come to us, well, I'm healthy, nothing ever happens to me. I go to the doctor once a year. Anything can happen. Your appendix bursts. You get into a car accident. These are huge medical expenses that you're not protected from if you don't have health insurance. And medical debt is a real thing that can really weigh on people and can really change what happens in a person's life. So I think that peace of mind, you may not realize that it's weighing on you, but the peace of mind of having health insurance is huge. And again, there are plans that are very affordable for families and individuals.
Finally, we should mention the number to call for the Mayor's Health Line.
617-534-5050.
Thank you very much for being with us.
Thank you.
Beth Baker from the Boston Public Health Commission.